We can take care of children with spinal deformities from birth or even prior to birth through adulthood. And it could be anything from congenital problems, developmental problems, idiopathic problems, or other things with spondylolysis or spondylolisthesis, problems with their low back.
Most of what we see as far as spinal conditions is scoliosis, which is a deformity of the spine. And the problem with scoliosis is we don't know what causes it. We have to treat it reactively instead of proactively.
Well, the treatment options can come down to something as simple as observation, when you know that something might be a problem, but not always. There may be simpler things such as orthoses, meaning bracing. There's casting that you may need to do on younger children. There's also different operations you may need to do in growing children.
For instance, some kids don't even know they have it, and they come in and you're telling them they need this major back surgery, and it's a big stressful event for the family. The good thing is it's become fairly routine here, and these kids that don't have any underlying problems can really get back to doing normal activity, including high-level sports, gymnastics, dance, within about 3 months. It's a procedure done from the back most of the time, and we put screws in these small bones here called the pedicles, and we instrument the curve, then we connect those screws have a little goalpost, and we bend a rod to fit the curvature of the spine. Then we actually unrotate the spine to straighten it up. Probably some of the biggest rumors that I hear are that the child wears a backpack on one shoulder, and that's going to cause the spine to grow crooked, or make a kid with scoliosis have their curve get worse, and that's entirely a myth. Another myth is that once kids have had the surgery, they can never go on roller coasters anymore. They can't participate in sports or dance, and entirely a myth.
For scoliosis in general, it's important that early detection is done, because early detection can lead to certain interventions that can avoid an operation, or if it's detected at an early enough time, the operation is minimum. Your back is very important to take care of as you go along. Your posture, your core muscles, how you exercise it, how you sit, it all makes a big difference.